The positive COVID test rates in Utah continue to increase to now over 21%. Healthcare workers say hospitals could run out of beds, and the fear of exceeding capacity could become a reality. Utah has about 564 ICU beds. 78% of those are in use, leaving Utah at high risk for hospital overload.
100% capacity is dangerous. They're out of resources, they're out of beds. And so you don't want to see a number above 80 because that means resources are running out, staff are running out.
Many Utahns express their frustration and feel their rights are being infringed on with the latest mask mandate. Yet, Jody Jameson, a local nurse, says it is essential.
So it only took one night for New York to turn from okay to not okay.
Jody gave us an insider's perspective, sharing that nurses have been brought in from other hospitals, such as pediatric units and even other states, including New York. Some hospitals began running out of room this past week and had to send patients to hospitals out of their network, which, according to Jody, has never occurred before due to a lack of capacity.
But we started preparing because all the other hospitals in Utah were going to send all of their pediatric patients to us. And so we stopped all elective surgeries to make sure we had open beds. But we did start getting COVID patients, and we even had adult COVID patients in our ICU, which we didn't expect to have. So it just kind of changed the flow of the whole hospital.
Nurses are being asked to work overtime, pushing their physical capacity to work extra on their already highly demanding jobs.
We're not complaining to the public that we're standing there and getting heat stroke day after day. We're not complaining now. It's 12 degrees this morning and my nurse's hands are frozen. We're not complaining to the public, but if any one of them stood in our shoes and were trying to help those that were getting sick, I would hope they would change their mind.
Morgan Dopp worked at a senior center over the past few months. She reminded us to focus on the numbers.
The data and the COVID cases are showing that it's spreading this bad. And we're at 3,000 cases. Let's focus on what the numbers are showing and now adapt to that.
Now topping 241,000 deaths, the number of COVID fatalities nationwide could fill the University of Utah's Rice-Eccles Stadium nearly 5 times over. While some deny the power of this pandemic, the stats are undeniable. Be smart and considerate. Wear a mask. Reporting for Newsline, I'm Catherine Bennett.